is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, it is a Friday version of the show. Hey, April 15th. I'm not even, when you hear April 15th, doesn't a little chill go up your spine? Okay, today is April 15th. Get over the chill. You got a little bit of time. I guess I can give you till Monday before they make you fess up. Today we're going to be fessing up on a topic that, has grown and grown and grown. Literally, from the professional viewpoint that I have looked at this topic, it has been helped in its growth by this gentleman. Certainly, he didn't invent a disease of thyroid anomaly that is so prevalent here in the western Pennsylvania area, but he did help shed an illuminating glance at how to take care of it based on good science, and about 8 years ago came across with his first book entitled Iodine. Well, that's led to many others, but the next in the series was logically going to be the topic that we discussed today. The subject, thyroid disease. Absolutely tied into the iodine story, and this gentleman, who you've come to appreciate, we've had him here in Pittsburgh. We've had him on the show many times. Today, he's back with us again. He's going to be our get him up out of town version today. Fridays appear to work well in his schedule. We've made it work well in ours, but still allow you to give us a call if you've got a mind to ask a question and make a comment as we're talking about this pretty prevalent disorder seen here in the western Pennsylvania area called thyroid disease. The number to do so, of course, as always, will be 412-825-6262, 412-825-6262. Dr. David Brownstein here with us today to discuss number 2 book, Thyroid Disease, Thyroid Disorders, and I've got a copy of that book right in front of me. In fact, we're going to be using it to sort of follow along and lead this conversation today. Now, talking about follow along with me as I now go through a pretty extensive and jam-packed remainder of the month of April. No, you're right. I got it flipped to it. Coming up on Monday. Oh boy, you don't want to miss this one. The Ruskies are coming. The Soviets are coming. It is going to be Dr. Michael Kiriak, along with Roland Thomas, going to be our guest on Monday. You got to pay attention to the show. If you were here at all for the last few months, you know we've introduced a new supplement into the realm of supplementation in a category called BAC, B-A-C. It, of course, stands for Bioengineered Algae Concentrates. And it all comes from the work of the Soviet scientist, Dr. Michael Kiriak. We've heard his story so often through the eyes and lips of one Roland Thomas, but in a conversation just about a month ago, the Michael Kiriak issue came up when I was talking to Roland, saying, Roland, how's he doing with his English? Does he speak English okay? I'd love to have him come on the show. Oh, he said, hey, he's doing well enough to teach conferences. And so I said, do you think he would mind coming on our show? We set it up on Monday. He will be with us. So Roland will be here. We'll have Dr. Kiriak with us here. I'm really interested in asking him a couple of questions. And just hearing the man, I've got a great deal of reverence for his work. You will enjoy, I hope, as I will enjoy too, having Dr. Michael Kiriak with us on Monday. Don't forget, next week, big doings around here, folks. And as I last checked, I think there's one slot left. There may be two, but you filled it up. Yes, we're going to be starting at 9 a.m., going to 5 p.m. Every 15 minutes, a new patient will be stepping up to get MCG testing. We've opened it up to the public. This is now our fourth testing seminar. The first group was a bunch of in-house patients. They were my initial testees. But then, as we open it up to you, you have responded magnificently. We'll try to have these at frequent intervals, but this being the fourth one, you should be commended for taking us up on the ability to receive testing of the coronary blood vessels, heart and blood vessels. That heretofore was only obtainable, at least that kind of information, through a full-blown cardiac cath. But who in the heck wants to have one of those? Consequently, this electronic gizmo called MCG, stands for Multifunctional Cardiogram, has been invented. I don't know how it works. I keep telling you, I don't know how it works. I've just come to appreciate the information we can get from it. You too can have that information about the status of your heart and blood vessels as though you had a full-blown cardiac cath without having that cath. And that'll be conducted on the 21st. Also, we just had the girls on the show on Wednesday. They're in the office too on the 21st to do thermography. So I know there's a number of slots left for that too. Give us a call in either case if you're interested in the last few slots available, and I think there is more than 3, or some of the more available slots for thermograms here on the 21st, 724-942-3002. Now, next Monday, we're going to have a newly added radio guest. Newly added because, well, we just learned that the Freedom of Choice in Cancer Therapy group has her as their featured speaker. They're all screwed up Butler. The Freedom of Choice in Cancer Therapy group is going to be meeting not on the 3rd Thursday, but the 4th Wednesday. Yeah, it's crazy. The 21st. Just remember, she's going to be there on the 27th. Her name is Ricky Pippin. She bills herself as a Christian author, teacher, and mom. Anyway, she's got her own approaches on how to confront a whole host of issues, health just being one of them. And she had a chronically ill child that the medical community had no solution for, but she worked it all out. She wrote about it, too, in a book called God's Health Plan, The Audacious Journey to a Better Life, and she's going to be talking to us about that on the 25th. You can see her in person up there at the Freedom of Choice in Cancer Therapy Group on the 27th. The rest of the stuff's the same. Yes, it's the day's in. It's at 7 o'clock. It's a mile south of Butler on the right-hand side as you're going north on Route 8. All that's the same. It's just they changed the date. So make that little note. If you're frequently going up to hear the Speaker of the Month, make that note and know that we have been once again able to solicit that guest to be our featured guest here on the show on the 25th. Then on the 27th, Brian Foltz is going to be coming on the show. He is a representative. We had Jimmy Moresic here for so many years. I will tell you, Brian is really knowledgeable in health matters, especially via supplementation. And he represents a pretty potent company with respect to high-quality supplements. That company is called Standard Process. We're going to be keeping a theme up. The issue that we discussed today, as a matter of fact, is one that we'll be focusing in on from the supplement side on the 27th, where we talk about thyroid disorders. And this company called Standard Process and all of what's available within the company with respect to the assistance and treatment of thyroid disease. And that'll sort of round out the month. Looking into May right now as it stands, oh my goodness gracious, every time I flip the page, got to mention that eye treatment seminar we have here in the second week of May. 2 seminars associated with it. A free seminar, general seminar, going to be held here on the 9th of May, right here in the office at 6 to 8 o'clock in the evening. Dr. Edward Condrat's coming back to town. We've had him on our show the past 2 Fridays, and we'll try to get him on here one other time before he actually comes. Every time we've brought him to you via this radio program, you have responded. You've had a number of really Great questions. You could see that the question was coming from personal anguish. You were having the eye problem. And I think I could say in all cases that every caller that we have brought on the show to ask us questions, ask Dr. Kondra questions, I got the distinct impression that they weren't too happy with the current progress that they're experiencing with conventional therapy. Now, that's just where the limitations of conventional therapy bring you, but Dr. Edward Kondra is not your typical ophthalmologist. Yes, he is a medical doctor, board-certified ophthalmologist, but he treats eye disorders different than anybody else, and he gets immediate results. If you're thinking about participating in the eye treatment seminar, that's a 3-day event that begins also on the 9th, but it includes 9, 10, and 11 of May here in my office. They try to limit it to a total of 10 patients. Last look, over a week ago, was at 7. Maybe that number has climbed. And anyway, to be involved as either a participant in the general seminar, or if you think you may have an interest in the treatment seminar, here's the phone number, folks. 1-800-430-9328. That's 1-800-430-9328 to reserve a seat in the general seminar or a slot in the treatment seminar. 1-800-430-9328. What else in May? And, yes, so far we got Susan Smith-Jones coming back on the 4th of May as we will fill out the remainder of the month as time moves on. Okay, let's do this. I just enjoy talking to this gentleman, and we're in a subject area that I see so often here with the patients that I have an opportunity to meet, especially female patients. Thyroid disorders are replete in this area, and I'm just so interested in finding out some interesting points of view that I can share with a fellow colleague who I think sees the same grade of patients that I do, because he lives in Michigan, and that's smack dab in the middle of a border belt also. So, let's take a short break, and in the interim, I'll go find him. His name is Dr. David Brownstein. You know him very well. Get ready to discuss. And if you have questions on the topic of thyroid disorders, coming up.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, let Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a blessing for your good health. Through the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on a Friday version of the show, slightly different. Yes, it is a Get 'em Up Out of Town version, but we're going to do it today with a gentleman. I just enjoy having him on the show every opportunity I can get. And it looks like with as many books as he's now written, that opportunity has been amplified ninefold, folks. He's got 9 books out there. We all know him to bring us the information first glinted at in about 8 years ago with his first work called Iodine. It was only a natural offshoot, it appears, that the second book in the offing had to be the one we discussed today, because the thyroid disorder connection with iodine is so strong. It was so nice to see that the logical progression was followed. I've just had an opportunity to finish that book today. The author, Dr. David Brownstein, our guest today. Let's talk about thyroid disorders. We are smack dab in the middle of a hot zone when it comes to how frequently this is found. And the author today should be able to tell us all about it. Dr. David Brownstein, thanks for coming aboard today with us, David.
Thank you for having me here, Dennis.
David, once again, just a quick kudo to you. The book that I had a chance to go through is an excellent book. I'm going to say to our listeners, it's one that they could easily use as a reference book. You were in keeping with your philosophy of keep it simple, don't get too complicated. Anybody could follow what you have written, and you've written it so well in this book called Overcoming Thyroid Disorders. You've got so many other books. Before I even forget to bring this issue to the forefront about how our listeners can get it, why don't you tell us about your website and the phone numbers that can be used, because I think people, as they listen to us today, are going to want to have this book in their hands.
Well, Dennis, my website is drbrownstein.com, drbrownstein.com, BROWNSTEIN.com. And the phone number is 888-647-5616 if they want to order anything. We have books and DVDs, and I'm sure we'll get into that today.
Absolutely. We know you also well. I'm a little embarrassed because normally I start with my guests having them tell us about themselves. We know you pretty well, David. I'm not seeing the need to get into this. Okay, I don't want to waste the time. I want to talk about these thyroid disorders that you've come to experience as a practitioner in your office. Of course, you look at them differently now, and than you ever did before, and have been doing this kind of work in this new approach for so long. It's old second hat to you. As you start the book, I think a quote, and I wrote that down, and I'm going to start off by asking you to use it as the gun initiator here. Here's the quote, coming right out of almost the first pages of the book, in which you say, physicians were more adequately equipped to diagnose and treat thyroid disorders prior to the development of laboratory testing. Meaning, I guess, that we were doing pretty well with finding this disease when we didn't have labs, and we're not doing too good since we have this sophisticated laboratory testing. That quote is so accurate, in my opinion, that to allow you to explain it, I think, is a good way to start our discussion today.
Well, Dennis, what I meant by that quote was that before physicians primarily relied on laboratory tests to treat thyroid problems, they took a good history, did a good physical exam, and then used the space between their shoulders to think about what they found and to decide what the diagnosis was and what the therapy would be for the patient. Unfortunately, in today's world, there isn't a lot of thinking going on, in that I was taught in medical school in the mid-1980s that to properly diagnose a thyroid problem, you do a blood test. And if the blood test is abnormal, then you give them prescription for thyroid hormone. If the blood test is normal, they don't have a thyroid problem. It was really, the way I was taught, there's no need to do a physical exam. There's no need to take a history and listen to patients. There's really no need to think. Just have to plug the numbers in and then reflexively write it out. it's almost to the point now where a monkey could do it, the way it's taught in medical school. And the problem with that is that the blood tests are not the most accurate way to diagnose a thyroid problem. Blood tests only reflect the circulating thyroid hormone levels, and they don't reflect the levels of thyroid hormone inside the cells where they do their work. And we don't even have a blood test to reflect what's going on inside the cells. So it's not to say I don't do blood tests. I do blood tests in my office, and I think blood tests can be very helpful, but they shouldn't be the overriding determinant. And what I wrote in my book is that if you're going to just rely on the blood test to, in my experience, to diagnose a thyroid problem, you're going to miss probably 40 to 60% of patients walking around out there with a thyroid, an undiagnosed abnormal thyroid problem.
Well, you raised a statistic which I had never seen in print before, which I still ponder, and I'll mention to you now. You say, when you rely on the blood tests alone, as I think you have now adequately described how most doctors, well into 90% of doctors approach this because they're taught this way in medical school. And this is confirmed so often when I sit across from a patient and I'm discussing thyroid disease and I have them say to me, oh yes, thyroid disease. Well, my doctor thought I may have thyroid problems. And we ordered the blood test, and it turns out my thyroid's, it's not the thyroid. And if I've got a dime for every time that I was told that by a patient, I'm sure you the same, we'd both be very rich.
I would totally agree with you.
A heck of a thing to have the patient say, no, it can't be that because we checked these blood tests. But the statistic here is if you use the blood test, you're only going to be able to identify between 2 to 5%. I never saw that in print before. Is that how how did you find that out? How did you extrapolate that?
There was a study in Colorado where the authors set up a booth at the Colorado State Fair, and they drew the blood from, I believe it was 20,000 or so subjects.
Oh, boy.
And they found that 10% of the subjects had an undiagnosed abnormal thyroid problem. They didn't take a history, they didn't do a physical exam, they just drew the blood test. And the authors estimated from that there were 12 million people across the United States with an undiagnosed abnormal thyroid problem. Now that's from just doing the blood test. My experience from doing a proper history and a physical exam and checking basal body temperatures, which we'll talk about, and then making a clinical diagnosis instead of just a laboratory diagnosis, that you will pick up another probably 50% or more of patients diagnosed with an undiagnosed abnormal thyroid problem. And that's where those numbers come into play. Now, I have lectured across the country and out of the country, and when I'm giving my thyroid lecture, I always stop and ask the practitioners, what percent of patients do you think, new patients do you think, have an undiagnosed abnormal thyroid problem that the lab tests are missing? And invariably, I hear the same comments from people who are looking at more than lab tests, somewhere between 40 to 70%. So they're seeing the same problems that I'm seeing. I'm seeing the same problems that you're seeing. It just depends, the reason most doctors aren't seeing it is they're just not looking for it. They're not trained to look for it. They just look at a lab test and they treat a patient as if they are a lab test. And I think that's incorrect when diagnosing a thyroid problem.
Well, I think that we resonate with this with our listeners right now because they could be very well being shortchanged by their own doctors, and they're feeling lousy. They don't feel good, and they're really confused about why they're feeling so bad. But they're convinced now that it is not thyroid related. When in fact, in talking about how you actually do diagnose thyroid disease, take it for a moment and talk about the blood test, as I would say, I don't really need that blood test at all to make this diagnosis. We'll get the blood work. We got to have it as a baseline. I do want to see where we start, but this can be done much more accurately without it. Talk about the better way of handling this diagnosis of this so prevalent disease in our neck of the woods.
Well, the first step then is to take a good history and, listening to patients and their complaints. And some of the things that I hone in on in my history are people tired? The number one complaint that I hear from my patients, I'm sure it's the number one complaint you're hearing from your patients. The thyroid is necessary for producing thyroid hormone, which not only revs the metabolic rate in the cells of the body, it helps to produce energy in the cells of the body. And other points of history that I listen to from my patients: are they cold? Do they have cold hands and cold feet? Do they have dry skin? Are they constipated? Their hair falling out? Are they puffy? And are they gaining weight? All these are related to thyroid problems. And these, when someone gives you all these thyroid complaints, which I list in my book, and there's other ones too: headaches, high cholesterol, memory disorders, mental decline, muscle weakness. There's a whole host of 30 or 40 things I list in my book. You start to wonder, is there something tying these together? Are each of these an individual problem that a patient has? Probably not. And after you do a history, you need to do a good physical exam, just as I was taught in medical school to do. And a good physical exam looks for some of these physical exam signs on the body, such as swelling of the face or swelling under the eyes, swelling of the tongue. An enlarged thyroid, and doing a good palpation of the thyroid can help. Checking the reflexes. And many times what I'll see in my patients is they have all these physical exam signs of thyroid problems. They have a whole host of complaints about thyroid problems. And then I'll have them check their basal body temperatures. That's the first morning temperature before you get out of bed. And a normal basal body temperature is about 97.8 to 98.2 degrees Fahrenheit. And an low temperature signifies that the metabolic rate of the body has slowed down. And the main driver of that metabolic rate is the thyroid gland. So a temperature of 97.0 first thing in the morning under the arm, or if you add a degree orally, 98.0 can be a sign of low thyroid as well. So then when you put the whole picture together, including blood tests, you can, I think, make a much more accurate diagnosis. And what I've seen with many of my patients is they have these normal thyroid blood tests because the blood test ranges are too large. Yet they have many of the complaints of low thyroid, they have many of the physical exam signs of low thyroid, they have low basal body temperatures. And since I believe it's better made as a clinical diagnosis than a laboratory diagnosis solely, that you can make the diagnosis of a low thyroid problem or a thyroid problem in general and give the patient the appropriate treatment. I mean, the proof in the pudding at the end is, do they get better on the treatment? And the vast majority of patients who meet the criteria that I describe in my book get better on the appropriate treatment.
Well, you certainly did elaborate on this. I'm looking at page 22 here in the book, folks. There's a list of over 45 symptoms, the majority of which, the ones that are most frequently experienced, you've already mentioned them, but there are so many more. And when you consider that these metabolic rates of every zip code in the body, every piece of tissue has to be responsive to a correct metabolic rate that goes on to allow that particular organ or zip code or group of tissues or glands to function. If you don't have enough thyroid, it doesn't allow any of the zip codes to function, and that's why you can recruit so many different symptoms from so many different organs and so many different parts of the body that almost seemingly you wonder, how in the heck could one pathology cause so much havoc? And that's the reason why. It's involved in the metabolism of every cell in every place of the body.
Certainly hit the nail on the head, Dennis, and it's important for the listener to remember the thyroid affects every single cell in the body 24 hours a day, 7 days a week. And if there's not enough thyroid hormone for that cell, that metabolic rate of the cell will be slowed, and the consequences are fatigue, weight gain, hair loss, brain fog, and so on and so on. And no wonder why there can be such a wide variety of symptoms when the thyroid's not functioning, since every cell depends on it.
Now, in keeping with them, I will say you brought out a host of symptoms I really hadn't associated with thyroid. And I've been a devotee of yours and espoused this approach to thyroid for quite some time. But I'm going to direct your attention just a moment because I think we've got to discuss this relationship, at least as it was made by someone that you thought an awful lot of, and his name is Dr. Broda Barnes, since departed, but nonetheless, not too long ago. It's only been a few years ago since he died, correct? I mean, you knew him personally, didn't you?
You know, Dennis, when I started to get started in natural medicine in the 1990s, he died right around the time I got started. I never got to meet him. I'm very active in his foundation that set up the Broda Barnes Research Foundation. So unfortunately, I didn't get to meet him.
Well, the gentleman is the virtual encyclopedia on thyroid disease. He is the one really attributed to the first writings on the subject. Just about everything he ever wrote about the disease that I can attribute to him has turned out to be true. This particular aspect is one that somehow has passed me by. And I want to ask you to comment on it because you spent some time in the book talking about the relationship that he made, I'm talking about Dr. Barnes made, between coronary artery disease and hypothyroidism. And yeah, I can remember the cholesterol connection and everything, but he went much further than that. Do you think you can adequately describe what it was that he did and how he came up with such a relationship? Because and how you feel about that personally? Do you feel that there is a strong relationship? Could you elaborate a little bit about this connection between thyroid disease and coronary artery disease, which everybody out there listening knows how rampant coronary artery disease is? They're just not appreciative of how rampant the thyroid component is.
Absolutely, Dennis. And coronary artery disease is our #1 killer. And the relationship between low thyroid function and the development of coronary artery disease was written about in the 19th century. I believe cardiologists should investigate a thyroid problem first before reflexively putting patient on a cholesterol-lowering medication. But that's another story. So back to the Dr. Barnes connection with it. Dr. Barnes was a family doctor on the East Coast, and he did some research with the thyroid and rabbits when he was a medical student. And what he found was that when rabbits were made hypothyroid, they would develop atherosclerosis in a pattern similar to humans. From that moment on, he really began looking closely at the thyroid function in his patients that had heart disease. And what he found was a direct correlation between low thyroid function and the development of heart disease. Well, not only did he find it in his patients, he did a lot of research studies. So one of his research studies took place in Graz, Austria. And Graz, Austria is a particularly good area to study because every person that dies in Graz, Austria gets an autopsy. And this has been done since the 19th century, still done today. So you can take population studies based on these autopsy reports and report on them and draw striking conclusions from that. So what Dr. Barnes did was he reviewed over 70,000 autopsy records, and the autopsies were done between 1930 and 1970, Graz, Austria. And what he found was that before 1930, most of the deaths that were reported on these autopsy reports were deaths due to infection, and that the patients who died from these infections died at a relatively young age, usually less than 50 years old. And at that time, before 1930, in Graz, Austria, heart attack deaths were rare. So what you could draw the conclusion at that time was that in 1930, infection was effectively killing off the weak at a young age. Now, let's move forward to 1970. When he started to look at the autopsy reports from 1970, deaths due to infections were much smaller than 1930. But now, deaths from heart attacks had increased 1,000% since 1930. So, compared to 1930, people in 1970 were surviving to an older age and dying of a new disease. They were dying of heart attacks. Now, Dr. Barnes' hypothesis was that either something new had entered the picture to cause the increase in heart attacks, or the surviving premature deaths from infections were now prone to developing heart disease. What he's saying was that maybe there's a new illness out there. Well, there wasn't really a new illness. He correlated the two increase in deaths with the same problem. They were both hypothyroid patients. And the correlation was found on the autopsy reports. The young who died before the advent of antibiotics, before World War II, the young who died of infections also had signs of advanced atherosclerosis. So although their death report had read infection as the cause, under autopsy they found the coronary arteries looked like old man's coronary arteries, even though they were young people, and many of them were children. So the only conclusion that Dr. Barnes could come to tie the two together was that they were both suffering from hypothyroidism. In the 1930s in Graz, Austria, they weren't using thyroid hormone replacement. Those who were born hypothyroid were suffering the ravages of hypothyroidism. That included atherosclerosis, and they were more susceptible to infection. And with the development of antibiotics just around World War II and just afterwards, these young could now survive their infections, live to an older age, but if they weren't properly treated for thyroid problems, they would die of heart disease. It was an amazing piece of work. I describe this much more in detail in my book, and really it would explain why today we're still seeing this enormous influx of heart disease affecting our society, because I feel that these people are not being properly treated. They're not having the hormonal system balanced. They're not having the nutritional system balanced. And the vast majority of them have undiagnosed abnormal thyroid problems, and they're still developing atherosclerosis from it. So the good thing now is, because of the use of antibiotics, these people are surviving infections to an older age, but we're suffering the ravages of hypothyroidism. And it was an amazing piece of work Dr. Barnes published. No one's been able to really refute that today, and I still think it holds true to what we're seeing in our society today.
Well, thanks for that explanation of what I thought to be a fascinating new twist. I never had seen such a relationship attempted to be made before, and you and I both tip off our hats to the great Voda Barnes, and I know that their foundation thinks quite a bit of you and feels that you're carrying in his footsteps, and I'd have to back that up 100%, my dear friend. All right, let's move on. One thing is this disease called thyroid disease, which appears to be like everywhere. You know what? I got people knocking on the door right now. You don't mind taking some questions, do you?
Of course not.
Let's let them in the store early, because they're chomping at the bit to get at you, David. Come on. You're Dr. David Brownstein. Go right ahead.
Good morning.
Hi.
I have so many questions.
Ah, you too, huh?
Where do I begin? I wanted to know, I had two separate questions. I wanted to know if you could explain the relationship, and if there is a relationship between the thyroid, the hypothalamus, pituitary, and adrenal axis. Like, what is the relationship?
Oh, what a gem question that is.
Why is it so prevalent in women, the low thyroid? I know, I guess our systems are more hormonal than men and intricate, but why is the exact reason why women have, more problems with the thyroid, the low thyroid, than men? Thank you so much.
Oh, boy, they sure do.
Let's take the second question first.
Yeah, let's do that one first. Go ahead.
Women do have more thyroid problems than men, but there's a couple of reasons for that. Number one, women go to the doctors more than men, and then don't go to the doctor until there's a major health problem. And what's one of the man's most major health problems is coronary artery disease. So it may not be quite as more prevalent as we think it is, just that men don't go to the doctor more often. But women, with their cycles and they have a much more intricate hormonal system that has a certain...
If you'd like to make a call, please hang up and try again. If you need help, hang up and...
Hello?
Okay, we're still here. I don't know what that was, but go right ahead.
Okay, so women have a much more intricate system than men, and their system can get off kilter, and they'll feel it a lot more than a man will feel it, such as their periods getting out of whack, or they're getting menstrual symptoms. And then when you couple in all the exposures to all the toxins that's out there, such as fluoride and all the estrogen-like chemicals that impact the thyroid and the adrenal and the hypothalamic system, no wonder that we're seeing such a rash of thyroid problems. And in regards to the first part of your question, Dennis, what was the first part of her question?
Well, she was talking about hypothalamic, pituitary, adrenal. Boy, she's put all the right ones in there, too. The interrelationship between them.
She did put all the right ones in there, and there's no question that is, it's like a symphony. And when that hormonal symphony is in tune with one another, it can do wonderful things for the body. But there's no question that there's a relationship between all those systems, and that the toxic environment we live in is causing imbalances between the hypothalamus and pituitary, between the pituitary and the thyroid, between the thyroid and the adrenals. And the consequence of this is people feeling tired, anxious, gaining weight, brain fog, and a whole host of chronic disorders. And I sort of look at the thyroid and adrenal systems like a teeter-totter. And when that teeter-totter is nice and balanced, people feel good, they have enough energy to do what they should do during the day, and they're happy. When the thing is imbalanced, either tipped to the thyroid side or the adrenal side, people are not feeling good, and they're suffering from chronic illness. And doing the appropriate testing and the appropriate exam can help identify which system or both systems that are out of play and how to restore that balance. And I describe that in my, my books and in my writing.
You sure do. And just for those that might be trying to look for a little bit of an edge, who would you say, patients come in when they're feeling exhausted, they've already made a relationship between that exhaustion and I guess the word adrenal exhaustion, okay, because they always think of the adrenals and they're not thinking thyroid. When you identify these, do you treat them concomitantly? Do you put the thyroid in the number one spot? Do you put the adrenal number one spot? Or do you try to work on that teeter-totter from the get-go?
Well, if someone is diagnosed with a low thyroid problem and you simply give them thyroid hormone to rev their metabolic rate, that's fine as long as their adrenal system is working. However, if their adrenal system is not working appropriately, giving them thyroid hormone will not accomplish what you want it to accomplish. It can actually make them worse. So it is an intricate system. It needs to be looked at together. It needs to be worked up together, and it's not so easy. It's not as easy as just giving everyone a little thyroid hormone. And that's where it's helpful to find a healthcare practitioner who's knowledgeable about this, who can work with you on this.
All right. They're chomping at the bit. They want some more of you, David. Let's take them in kind. Go right ahead. You with Dr. David Brownstein.
Hi, good morning.
Hi.
I have a couple questions. My daughter, she's 25 years old, and she went to a routine appointment with her doctor, and the doctor found a lump on her thyroid. She went and had a sonogram, and they saw 2 to 3 nodules, and she had it tested, and she got the test back yesterday. And the doctor said it was inconclusive, but they are mutated, abnormal for a 25-year-old, and they're suggesting taking the thyroid out.
Oh, boy.
She works, the other piece to this is she, 8 months ago, went to an ND homeopath here in Pittsburgh, and she, that woman found that she had lead poisoning. So she's been working with her with herbs and nutrition to clear that out. I'm just wondering if you think the two are related and what your suggestion would be.
Well, certainly the two can be related, and there's heavy metal toxicity can certainly impact thyroid function and cause long-term thyroid problems. As far as what she should do, she should get a clear diagnosis and then proceed from there. If she has thyroid cancer, my suggestion is to surgically have it removed. The studies are pretty clear that removing thyroid cancer is a much better route, and the long-term consequences of a thyroidectomy are far lower than leaving a slow-growing thyroid tumor in place in a young person.
Well, what would you do if it's inconclusive?
That's inconclusive. Well, she might want to send it for a second reading somewhere else, and that's what I've done with a lot of patients, where send it to a different pathologist to let them review it, and then try and get if it's still inconclusive, then maybe perhaps do another biopsy.
Let's just say don't run to get that surgery done, okay? Right now, what I'm hearing is it doesn't sound to be enough information. You have cysts that are showing up on a sonogram. Okay. I don't know enough yet just to think that you should jump from that little bit of diagnostic reporting to a thyroidectomy. We're not there yet.
All right.
There's steps. There are things to do in between.
And you know what? You got a good doctor and dentist who's there who can help guide you through those steps.
Come on around. Please bring her. We'd be happy to work her up, okay?
Okay, great. Thank
Absolutely. They're chomping at you, David. I think another caller's out there still. You still out there? Come on ahead. Hello?
Hello?
Yeah, you're there. You're with Dr. Brownstein. What is your question for him today?
Well, I guess he answered some of them about testing the adrenal gland first. I was put on Thyroid probably 20 years ago, and I never really felt good after that. And then just about a year ago, well, maybe a year and a half ago, I started experimenting with the Armor, and my doctor put me on this T3, just 3, because the TSH was always wrong, and everything I took, and when I would quit, even for a few days, I would feel better. So we kept trying a different product. So finally, about a year ago, I said, okay, I'm quitting all of this. Everybody says you can't do that. I have never felt better in my life. I think it was my adrenals, and I think they kind of have felt, I feel better. I feel better than I have for years. So one of my questions was, what do you think of Thyroid? And what would you prescribe? And I know you talked a little bit about how to diagnose this through the skin and physical exam, and that the blood test, the TSH, is not really conclusive because it can be affected by many other things.
All right, I see where you're going with this, ma'am. I tell you what, David, if there's one thing I know you got a definite opinion on, so do I, the treatment side of this, and that's Thyroid, ma'am. Why don't you just hang up and listen, because we were going to get there anyway. We might as well get there right now. What do you think, David?
Well, in medical school, Dennis, we're all taught that the treatment for thyroid problem is Thyroid or Levothyroid, and no other options out there. That's ridiculous. That's not to say some people don't do well in Thyroid and Levothyroid. They do, but there's a more natural thyroid preparation from porcine thyroid, glandular tissue, and it supplies other thyroid hormone than just what Thyroid and Levothyroid supply. And I describe this in my book in more detail. And many patients do better on the natural thyroid than the Thyroid. Again, a healthcare practitioner knowledgeable can help guide the patients through this, and sometimes it's a little trial and error, but the vast majority of patients do better on the desiccated thyroid versus the plain Thyroid and Levothyroid products.
Okay, and by the way, ma'am, one thing I would suggest for you to do if you're nestling off air now. Are you still there, ma'am? Unless you went away. What do you think, David? If she would check her basal body temperature, she should be able to confirm the fact that her temperature is normal, and really maybe all of her symptoms initially were not thyroid related. We rely so much on the basal body temperature in making the diagnosis, we should be able to rely on it to reject the diagnosis too, correct?
Fully agree with that.
Perfect. Another knock. They're trying to they're clawing at you, David. Come on in the store. You were Dr. David Brownstein. Go right ahead.
Good morning, gentlemen. Two questions. First, the 97.8 to 98.2 range.
Yes.
Was that the underarm or by mouth reading?
That's the underarm reading. So by mouth, you would add a degree to it.
Okay. Second, if it is low, what can a person do, say, on their own to help make it functionally healthy, such as seed kelp with the iodine? Because I've heard, whole foods are better than just isolated aspects of something most often. Or I've heard maybe Dr. Courtney reference iodoral. What's your thoughts on that?
Well, number one, getting a full workup can identify, it's not just iodine. There's zinc, there's vitamin A, there's magnesium, there's a whole host of nutrients that play into proper thyroid function. And sometimes, I just saw a lady in the office yesterday, and he had every sign and symptom to meet the diagnosis of low thyroid. On her laboratory test, she had low iron and low zinc levels. And I told her that perhaps her low thyroid problem was due to this low iron and low zinc problem. And I said, let's get your nutrition side of it up, and then see how you're feeling, and then check your levels again in 2 months before we just reflexively go on a little thyroid hormone. So there's a whole bunch of things that play into this, iodine included. I've written a long book on iodine and done a lot of research on iodine, and my experience is 95% of patients are significantly low in iodine, and their thyroid will not function normally when they're that low in iodine. So that has to do with it as well. I think the best source of iodine is to use a pure source of inorganic non-radioactive iodine, such as iodoral or Lugol solution. The problem with kelp in some kelp samples are that they're contaminated depending on where that kelp is grown. And certainly with this nuclear reactor in Japan releasing tons of radioactive iodine into the ocean, our oceans are polluted, and you have to be careful about where your iodine source is coming from. So I prefer to use a pure iodine source such as iodoral or Lugol.
All right, let me just shoot one more and I'll hang up. What if your underarm reading is almost always higher on one side? Mine on the right side was always higher than the left. What's your thoughts on that? I'll hang up and listen. Thank you, gentlemen.
I would take it under your mouth then and use that as the King Solomon measurement.
Subclavian steel or something circulatory going on there. Yeah, sounds like a smart idea. Thank you very much, caller, for those great questions. Tell you what, as you can see, David, they're just chomping at the bit to get to you. I'm going to ask you now. You know you're going to have to come back to continue this discussion, don't you? You know that.
I'd be happy to.
Okay. Well, I promise you, listeners, off air, we'll come up with that date. I'll have him look at his book. We'll look at mine. And with a few minutes left, how about taking this question from me, because I think it might sum up a lot of what my listeners would be thinking with respect to thyroid disease. And so here comes the question. David, with especially knowing where you practice, you're a Michigan guy, okay? I'm a Pennsylvania guy. We're smack dab in the middle of what's called this goiter belt because of the poor iodine in our soils. Are you finding that there are ways of correcting thyroid disease by use of the non-hormonal, strictly by the uses of supplements such as iodine and other thyroid-supporting supplements? Or do you find pretty much that by the time you're making the diagnoses, especially as we move into the age groups of 30s, 40s, 50s, and so on, that you can't rescue that gland by the use of those supplements alone? Early on, I'm sort of putting my plug in. I'm interested in your response. Early on, yes. Later on, absolutely not. How do you feel about that? Is a supplemental rescue possible as you age with thyroid disease, or is it pretty much always going to require the need for that hormone?
Well, Dennis, there's no question that it's much easier to treat anything at 20 years old than it is at 70 years old. And depending on the status of the patient, sometimes the supplemental is helpful. But look, I certainly won't deny the older somebody is, more beneficial it becomes to use a small amount of thyroid hormone when it's needed. And I would agree with. I'm seeing the same findings you're seeing.
Yeah, tough to think to turn it around, because my listeners to this show, I think the people that come to see you, are health oriented, and they look at this hormone as it were a drug, when in fact I'm trying to make the case that, look, this is no drug per se. This is a hormone. You're lacking it. You don't have it. Don't be thinking about pharmaceutical drug preparations. This is something you've got to have, and you got to get over this thing about, all drugs, underline the word drugs, are bad. This is pharmaceutically prepared and delivered to you, but nonetheless, it ain't no drug.
Absolutely.
Okay. Well, we're going to be coming right up to the gong, and I tell you what, David, I knew doggone well we weren't going to get through this. It's sort of crazy to think we would. We have so much more to discuss. I do want to ask you about this conversion factor, T40, T3. I think it's a new concept, especially to learn all the things that are in your book about how many things can disturb that conversion and how prevalent all those things are really to be found. The use of selecting the synthroid versus the armor versus the cytomel is a concept I believe would be perfectly appropriate to spend some time with our listeners. So I'm going to say you got to come back here as soon as you can, and we're going to do that off air, all right?
Sounds good.
Okay. Ladies and gentlemen, there you have it. I will say that Dr. David Brownstein's book, available to you one of two ways, drbrownstein.com, that's drbrownstein.com, or give him a call at 647-5616. You can read this book. This isn't a medical book per se, to the extent that this is complicated medical information. It is written by a gentleman who is able to put this in such a way to easily allow you to digest it. And I think you want to have this sort of as a primer in your own library, as I now cherish and have in mine. So, that being said, I'll be allowing you to take it to your weekend out there and enjoy your, well, I guess it's going to be a little rainy tomorrow, so enjoy today. I'll see you on Monday. Don't forget, on Monday, we're going to have Dr. Michael Kiriak with us. I don't know how your Russian is. Mine's awful bad. And I'll be with Roland Thomas and him on that date. Until then, this is Dr. Dennis Courtney with Dr. David Brownstein saying so long for AM Impact on Your Health.